All right, so in today's mobility video, we're going to work on a mobilization video for addressing some stiffness or any pain that you could be feeling in the posterior deltoid, the back of the shoulder, or around this scapular area here where it connects into the shoulder girdle. This could even be part of your lat or your infraspinatus. So what we're going to do is we're also going to address a little bit of the trapezius, because this entire shoulder girdle of the posterior, if it gets tight in places, then it can be really difficult to get a full overhead range of motion, to press or catch something overhead, or you just feel some pain and discomfort as you're going through different movements. So what you're going to need for this is you're going to need a ball. Okay, what I'm using right now is called a lacrosse ball. It's really stiff and hard, so it can get really deep in there. But you can also use a slightly bigger ball. You can use a tennis ball or a baseball or a cricket ball. Essentially, you want it to be stiff enough that you're able to get some deep massage into your tissue there. And so first what I'm going to do is I'm going to lie down on top of this ball. I'm going to put it right here on the back of my deltoid here. Kind of there's a little gap here underneath your shoulder. I want to be right on top of this posterior deltoid here. So I'm going to put the ball right there. I'm going to lay down on top of it. Now this may be a spot right here where you're already feeling some pain, okay? So if it's painful or a little bit uncomfortable, that's okay, okay? So the main idea is you want to create some movement. I want to be rotating my shoulder, kind of working through those tissues. What this is doing is just creating some agitation in the tissues. And it's going to help direct some blood flow here. Okay, and I can roll a little bit on top of that ball. If you find a spot that's really sensitive, I call that a hot spot. Find a spot that's really hot right there, then you can stay there. And what you're going to do is you're going to put your hands together here, and you're going to contract that shoulder. You're going to try to rotate against your hand, and you're going to try to contract your muscle a little bit there. And take a deep breath and breathe through this. Contract, hold that contraction for 1, 2, 3, 4 seconds, and then relax. And just breathe and relax into that position. Okay, and contract again. 1, 2, 3, 4. Breathe and let it relax. You keep doing this until you feel a change, until you feel like it's beginning to relax a little bit, until you feel a little bit less pain. This is going to help the nervous system say, hey, it's okay to relax, and it's also going to help direct some blood flow, and it's just separating those tissues and working on that relationship a little bit so that you can feel better here. And just keep moving through rotation. It only takes a couple minutes in a certain area here. And overall, I wouldn't spend any more than 10 minutes working on this so that you're not going to essentially damage or bruise the tissue so you're actually sore the next day, okay? Now, once I get done with that, I feel like I'm looser there, then, oh man, I can sit up, I can see like, okay, yeah, I can actually feel a little bit of improvement there. I can get it overhead a little bit better. Now let's work on the trap here, okay? So you don't want to be right here where the trapezius muscle and the rhomboid meet, because there's a bunch of nerves in there. So you gotta be careful. You don't want to smash directly on that. We want it right on the meat of the trap right here. This big old muscle here that helps you shrug your shoulders, okay? So what I'm gonna do is I'm going to lie down here. I'm gonna put this ball right in the meat of that, okay? And I'm just gonna be kind of rolling side to side, okay? And you might find different spots. Some people might find a little bit of a hot spot that's closer to the shoulder, where the trap meets the shoulder. And some people might find it closer to the neck. Depends how you carry yourself, depends how you're moving, depends what your technique and your movement patterns are like. But move through this, okay? Move your shoulder at all angles. Keep moving through it. See how far you can get. Try to keep your elbow locked so your arm is moving straight. Okay? And you can move side to side. I like to sort of hold it up here. And just kind of rotate side to side. This allows you to get a nice angle here where you naturally hold it here. And it kind of helps you set your shoulder in a good, healthy position. And you can work side to side on these tissues. And if you really find a hot spot here, kind of like we did with the posterior delt, what you can do is you can really dig into it. You can lift your pelvis up off the floor to get some extra pressure. Take a deep breath and hold a contraction. So I'm going to pull this fist down so I can pull my shoulder down to the floor. Contract, hold that 1, 2, 3, 4, and relax that shoulder and sink down into that position until you feel a change in that tissue. Keep moving through this. Okay, find your hot spots. Wherever you feel that tension is where you want to focus, okay? As you get through that, man, you finish this mobilization routine, no more than 10 minutes, you're gonna be able to raise your hand and have some significantly improved mobility. But then you can do this every day or every other day, but working on this is gonna help you loosen up any pain or tension in your tissues, and it's gonna help you improve your overhead mobility to move better.